Good evening, and I've come here now to talk about another book I wrote when I was when I was away and not doing this for a little while. I was concerned about the creeping privatisation of the NHS, which has been done by both parties since Margaret Thatcher first came to power in 1979. And I wrote a book about it, which again is like my book on slavery, is published with Lulu. It's called Privatisation, Killing the NHS. I don't know if you can see it. And I'll just read out the bird from the back. The National Health Service is Britain's greatest institution. Founded in 1948 to provide the British people with healthcare that is universal and free at the point of use, it has cured and cared for the sick for nearly 70 years. Now it is in the gravest danger. Right-wing politicians from Margaret Thatcher onwards, including John Major, Tony Blair, and recently David Cameron and his health ministers Andrew Lansley and Jeremy Hunt, had carried out a campaign of gradual privatisation. The goal has been to sell off the health service and replace it with a system of private healthcare financed through private insurance. Britain's NHS was efficient and cost-effective before these reforms. It does not need them. And if completed, Britain will return to poor healthcare and conditions of chronic disease and deprivation seen before the NHS's foundation. This pamphlet describes not only how politicians from all parties have conspired to destroy the NHS, but also shows how people, medical professionals and politicos have been campaigning against that plan. For the sake of the NHS and the health of the British people itself, we have to stop the Conservatives' privatisation before it is too late. Yeah, the book is strongly against the Conservatives because it was Margaret Thatcher who began this process in about 1980. She wanted the health service privatised just as she wanted to dismantle the welfare state altogether. There was a there was a cabinet revolt, I know, and it was stopped. Also part of this was the fact that her personal private secretary, Patrick Jenkins, travelled to the States to report on what the American healthcare system was like, which is mainly funded through private health insurance, and he came back and told her it was terrible. Now, there is some state-supported healthcare in America through Medicare and Medicaid. Medicare applies to the poorest groups, and I think Medicaid is for the elderly poor. But most of it is done through private health insurance. And if you don't have private health insurance, then you don't get medicine. Lack of health insurance is the reason why 40,000 people a year die through a lack of medicine in the US. I've heard that about 20 million people now don't have health insurance. It might be bigger. And medical bills are the single biggest cause of bankruptcy in the US. This is the state that the kind of condition which Margaret Thatcher and her ideological children wish to return us to. Now, her programme of privatisation for the NHS was halted, but nevertheless, she wanted a certain percentage, I think 10 or 15% of the British public, to take out private health insurance. Then, after her, John Major began to introduce private healthcare into the NHS under his private finance initiative. This is where private corporations would take over hospitals and start running them, or they take over some of the services, some of the ancillary services in private hospitals and in state hospitals and run them, like the cleaning or the cooking. It was done by Peter Lilly specifically to open up the NHS to private industry. And then you had Tony Blair came along and he expanded it. He introduced community care groups, which were groups of doctors who were supposed to decide where they commissioned private, where they commissioned their healthcare from, and this could be from private industry groups. Legislation was also mooted, possibly passed, allowing groups of doctors to become private companies or go into partnership with private industry. He wanted the polyclinics or the health centres he opened. He felt that they should also, or could also, be run by private healthcare providers. And yeah, I mean, under Blair, Alan Milburn, his private secretary, his health minister, wanted the NHS to become just kite stamp on services provided by private industry. Then it was taken a phase further by David Cameron, who started privatising and giving more contracts out to private healthcare companies. Andrew Lansley passed his legislation, then saying that the current Secretary for Health is no longer responsible for guaranteeing everyone has access to healthcare in the UK, as was written into the original NHS Charter. It sounds, if you read the legislation that was put in instead, it sounds like he still is, but he's not. It's something like a technical detail, but it means he's only there to ensure that that there are healthcare companies or healthcare that should do the job. It's all very nebulous. And then under Theresa May, this process has gone on again until something like, I don't know, 75% of all contracts, health contracts, are given to private industry. And the result has been disastrous. This book tells you actually how disastrous it will be. Because contrary to what they are telling you, private industry is not as efficient in tackling illness as state medicine. Never has been, never will. Fully private hospitals are smaller and they do a more restrictive range of operations. Furthermore, private medicine does not like the long-term sick or people with pre-existing conditions because they need constant treatment or they need more treatment than the patients can possibly afford. They want people who are reasonably well and only sick for for a short time, so they can pay the fees and then get off. A lot of this privatisation really is to make sure that to support the private healthcare companies and to make sure they're in profit. There's no other reason for it. I describe just why in the book, and I describe what healthcare was in this country before the foundation of the NHS. And the NHS made a lot of difference. Again, like America, there were state hospitals under the poor law, well, local authority hospitals under the poor law for the very ill and the very poor. Yeah, it was the very poor rather than the very ill, sorry. If you weren't that poor, if you weren't a pauper, then there were the voluntary hospitals and the charity hospitals, all of whom survived by, well, private donations or for the charity hospitals and payment in the voluntary hospitals. Again, with the doctors weren't part of any state medical care, and people often could not afford to pay for the doctor. And I'm dreadfully, dreadfully afraid that this is the situation we will return to if the NHS is not renationalised under a proper Labour government. This is what I say in my book, and I draw on a very long number of sources for it. There are already some very, very good books about the threat of privatisation to the NHS. This book is only 42 pages. It's £5.25 from Lulu. Even if you don't buy it, I hope you will take notice of this video and campaign against this privatisation of the NHS. Thank you so much for watching.